patients are willing to spend on holidays on their mobile phones and their watches. For them to enjoy all this, then they need the best of eyesight. So why not make a one-time expenditure on this? And this resonates with most patients. Cataract surgery is the most frequently performed surgery in the human body, and refractive surgery is the next most performed surgery in the human body. And this machine takes care of both of them. And with the earlier iterations of femtosecond lasers, with some of them I was never very comfortable with the incision part of it. But with the Z8, what we find is that these incisions are extremely precise. And we are almost invariably being able to open these incisions, so that it's truly bladeless surgery that we are performing.
Hello everyone, I am Dr. Prakhyat Roop. I work at Acura Vision Clinics, Roop Netralaya, Meerut. I am a cataract cornea and refractive surgeon, and today I have with me Dr. D. Ramamurthy. Sir is a veteran surgeon, one of the senior most surgeons that we have in our country, and he's a prolific surgeon who has had an experience of lakhs of surgeries, including cataract and refractive surgery under his belt. He has seen the eras change from intracapsular cataract surgery to extracapsular and now to robotic cataract surgeries, in which he is a pioneer. Today I am going to be speaking to him about his experience of robotics, robotic cataracts, lenticule extraction surgery that is clear, and all the other life experiences that he's had. And I think it's the first time that Sir would be doing a podcast. So
I've done this before.
So he's had an experience of doing podcasts also. So Sir, thank you so much for coming to this and agreeing to do this conversation with me. I am really excited and honored to be doing this conversation with you. My father admires you. You've been his senior from the same alma mater. We've through the years I have learned so many things about you. You've seen the eras change from intracapsular cataract surgery to today, robotics in almost everything that we are doing in cataract and refractive surgery. So just to begin, I want you to tell our audiences what is the real role of being automated or using a robot compared to not using it. So if we put it simply, how would you tell the patient that this is beneficial for you?
Thank you, Prakhyat, initially for giving that very eloquent introduction. Very kind of you. I know you and your family very well, and coming from you, it means a lot to me. And coming to your question about robotic surgery, it's just a question of precision, repeatability, and getting every time exactly what you want. Even if I were to just make an incision from here to here on my hand, I have almost 30 years of surgical experience. I can easily do it with a scalpel. But if the same incision was done using a laser, which is guided by certain OCT, etc., then the precision improves much better. So if I do 10 cataract surgeries or 10 refractive surgeries in a day using this equipment, then I'm going to get exactly the same results, exactly what I want. I need a 0.5 millimeter incision at 1/4 millimeter depth. That's exactly what this is going to give. So it's a question of having the perfection, precision, repeatability, which translates into excellent outcomes as far as the patient is concerned.
So basically, going in for an automation or a robotic platform compared to the previous surgeries, how do you see the difference? How do you tell the patient?
As coming to your question about robotics, it's just a question of the kind of control and repeatability that the equipment brings to us. I have been doing surgeries for more than 3 decades. But if I were to make an incision on my hand from here to here, if I were to do it with my own hand with a scalpel, and if I were to do it with a laser, the kind of repeatability, precision that I get would be much better. If I want a 0.5 millimeter incision at 1/4 millimeter depth, that's exactly what the machine is going to give me, which is obviously not repeatable by any human hand. So it's perfection that translates to better outcomes as far as the patient is concerned. If I were to do 10 surgeries in a day using robotics or more precisely the lasers guided by tomographic equipment, then it's going to translate into the same results that each one of them get, which should get better outcomes for the patient.
So basically what happens, sir, with me, that sometimes a patient would come to me, they got a cataract surgery done with phacoemulsification 15 years back when we did not have robots, or the robots were in a very early stage and we did not have this level of precision in robots. And they say that, doctor, when you did surgery for my father or whoever, he had a great outcome. So now why should I choose a robotic surgery? And I think you must be facing that question very often, because a lot of patients come back to you for generations for treatment. So how do you answer that to them? Like, how would you respond to them, giving them the simplifying the surgical steps for them, or how do you interpret that information, that scientific information to them?
No, first of all, we never give an impression to the patient that this type of robotic surgery is absolutely necessary for you. If affordability is a criteria and they are quite happy with they do not want to spend a significant amount, then obviously we would go ahead and do what the patient wants. Mm-hmm. So it's just but at the same time, we have a vibrant middle class in the Indian population who want the very best, who are very well informed, who obviously what was there 10 years back to today are willing to spend on their health needs. And these are the patients in whom we offer them as choices. We tell them that you could get a conventional phacoemulsification done, you could get good results, but if you want the very best in your eyes, then go for this. So patients are willing to spend on holidays on their mobile phones and their watches. And for all this, for them to enjoy all this, they need the best of eyesight. So why not make one-time expenditure on this? And this resonates with most patients. So if a patient I definitely don't want them to sell off something to get a robotic surgery done. But if he or she is wanting the very best in their eyes, then we encourage them and tell them this is the choice you have. So, we all are used to non-air-conditioned cars 15 years back. But today the norm is to go by an air-conditioned vehicle. And all of us have got used to it. The same thing applies to the comforts we have at home. So times are moving ahead. So just because something worked 15 years back doesn't mean that you stay with that right now.
So basically, if simply put, it may not be the most cost-effective option, but it is the best option. So if cost is not an issue and you want the very best, then you go for the robotics. If cost sensitivity is an important thing, like for the charitable kind of a surgery or for the masses, then phacoemulsification works okay. That's basically how
I can't agree with you more.
So, sir, when we look at the Zemer Z8, I have had experience of only using 2 lasers for cataract surgery, which is the earlier versions which used to have larger laser spots, bigger size laser spots with gaps in them. At that time, the Rexis would be something of a challenge, and there used to be a debate about this, that is femtosecond laser safer than phacoemulsification? And the naysayers would say that, in this Rexis, there is a chance of runoff when you are trying to do a hydro and all those things. So now, the way I look at it, that time the Rexis would be ragged. But now with Z8, I have had the maximum experience with Z8 and I never had a runoff. So do you think that problem or that downside is addressed with the Z8, which is not addressed with any other platform as far as Rexis is concerned?
It's absolutely right. Like everything else, all equipments evolve over time, and each company benefits out of the experience of other companies. And compared to the earlier iterations of the femtosecond lasers, which are used for cataract surgery, they were slower, they're much larger spot size. So basically what they use, the Rexis, specifically since you are referring to it, they used to create what's called a postage stamp kind of a Rexis, where there are gaps in between. And obviously because of these gaps, sometimes there was a slight weakness of the Rexis margin. But on the other hand, a machine like the Z8, which fires at 20 megahertz, which is the fastest laser available in the market, with the smallest spot size, with least amount of energy. Obviously, it's extremely friendly to the eye, and the spots are almost contiguous, that is, they are touching upon each other.
Right.
So it's continuous.
Right.
So it's most often we get a free floating rexis, and even in difficult cases there's already a nice template that is made, and you just have to pick off the rexis.
Yes.
And practically speaking, there's both pros and cons as far as published literature is concerned as to which rexis is stronger. But in my wide experience with these rexis, whether it's for doing the surgery subsequently with the phacoemulsification, or for implanting the intraocular lenses, or for using hooks, etc., these rexes withstand that very well. I don't think practically it's no weaker than what we do manually also. And obviously it has advanced quite significantly over the initial experience that we had.
In fact, I was recently looking at a study which was done on around 8 different platforms, and they did electron microscopy for each of them. And they had actually shown with the edge section of the edge, and I could not make out the difference between the Z8 and a torn rexis which was manually done. So I was thinking that it's eventually come of age to the point where you have the safety and precision, and also have done away with the side effects or the downsides that used to be there with the previous robots.
Absolutely. It's not just the electron microscopic studies. Studies are also available on the strain index, where the rexis has been made on experimental animals, and then subsequently they have subjected it to amount of strain or stress that they can withstand. It has been, one study has actually proven that these rexis are double as strong as what is created manually. So suffice it to say, as clinicians, as surgeons, we are quite happy with these rexis because they withstand whatever maneuvers we have to do in the eye.
And basically, to explain it simply to the audiences, rexis is very important for us because rexis decides the final placement of the lens and its long-term stability. So 10 years down the line, 20 years down the line, this circular cut that we are placing on the anterior part of your lens, the anterior capsule of your lens, its position, size, centration is what is going to determine whether your lens changes its position over a course of many years or it does not. That is why we discussed in such length about the rexis. Right, sir?
Absolutely. And it's not just the rexis, the incisions which give us access to the inside of the eye. We promote femtosecond laser cataract surgery as bladeless surgery. And with the earlier iterations of femtosecond lasers, with some of them I was never very comfortable with the incision part of it, and used to make them with the blade because they used to be more controlled. But with the Z8, what we find is that these incisions are extremely precise, and we are almost invariably being able to open these incisions, so that it's truly bladeless surgery that we are performing, apart from the improvements in the rexis that we talked about.
Yes. Sir, moving on, I want to talk about refractive surgery. You are a veteran refractive surgeon. You have changed the scene in your practice, your region, India. You've been a staunch supporter of better technologies always. I've seen you've never shied away from uptaking a new technology. Even at this time where you've had so much experience, one may say that they are not interested in newer technologies anymore, but you keep yourself updated. You always talk about the latest. And in that regard, I think you took up the low energy lenticule surgery very fast, and I think you were the first ones to give us the experience of so many numbers of surgeries and optimize the energies for us. So tell me, how did it start for you? Like, how was the journey in the beginning? The low energy laser concept, what did you make of it? How different was it? And how did you come to these great results with Clear?
As you put it, we started with the excimer laser refractive surgery way back in 1997. That's almost 3 decades back. I think you must, I hope you were born then.
Yes, I was just 4 years old.
Okay. So it's been a very rewarding experience, not just with the Zima machines, but then over a period of time, we have always graduated on right from a microkeratome LASIK flaps, then we used to femtosecond flaps, and now the best way to perform this surgery, as far as the patient is eligible for it, is to do a lenticule-based surgery, and there are the good thing about is nowadays we have the freedom of choice. Just like you have different models of cars and you can pick and choose what's best suited for your needs. Now we have several available in the market, and obviously the advances made in one particular platform impinges on the advances made in the other. So overall we get a great product, and Z8 has brought this transformational change. And I believe that whether it's one of the best things about this machine is that cataract surgery is the most frequently performed surgery in the human body, and refractive surgery is the next most performed surgery in the human body. And this machine takes care of both of them. And once you have this, both cataract and refractive surgery, you are able to do it in the most precise manner. And as we already discussed the advantages in cataract surgery, similarly in refractive surgery also, the extreme speed of this particular laser, the precision of the spots, this low energy levels creates these lenticules almost absolutely free, so that very little dissection is needed, and you are able to get absolutely repeatable results day in and day out.
So you very rightly said, sir, that when one technology is good and one company or one machine brings it out, everybody else should actually take it up, which is the right way to go forward. But sometimes in social media, what I've seen is that, we know that the low energy laser was there with Zimmer for more than 10 years now. But a new machine comes, say, 10 years later, and it says that, we are the ones who have brought you this type of laser and this energy settings and all these things with no gap spots and everything. And suddenly on social media, everybody starts believing that everything else is not right and this is the best thing, and it may not even be true. Now what it causes to the patient is, it causes a mental agony sort of thing, where the patient thinks that if I didn't get this thing done, then I have got something inferior and it's not the best thing and it's so bad. And it kind of creates an anxiety in the patient's minds. And every few years, every 1 or 2 years, we see that some new marketing tool comes, the technologies may not be that improving, but a new tool or a new company would launch a same technology that is pre-existing, and they will say that this is the best. And then there would be people who lack knowledge or lack nuance, and they would say that, this is the best thing for everybody. So you've seen these things change for so many years. I want you to tell us how you look at it, and how should patients, like a young patient who's 22 years old, is very impressionable, thinks that YouTube is very important, should look at it?
I think a very relevant question, Prakyat. I think most of my practice was built upon word of mouth referrals, and that used to be the norm, where one satisfied patient talks to his relative, talks to his friend about the kind of outcome he or she had, and then says that, recommends that, and they used to come to us, whether it's cataract, refractive surgery, retinal surgery, or even for a simple refraction. Now, unfortunately, people don't seem to talk to each other so much. It's now, rather than word of mouth, it has become the word of social media. So they just sit in a room, go through their devices, and it's the digital output which seems to influence their decisions, whether it's be the choice of the restaurant or choice of the procedure in the eye. So I think it's unfortunate, because somebody may be having a slightly inferior product, but just because of the noise they are making in the digital platform, that particular practice or that particular equipment might get promoted more. So essentially, as we all know, digital media, social platforms have their uses. They're extremely important in today's life. But then you have to be discerning. You have to get the right kind of information. It's most important that you talk to patients themselves, those who have undergone the procedures. talk to them about the experience that they had, and then decide what's good for you. Frankly, we actually have a list of patients who have undergone, whether it's lenticule-based surgery or a femtosecond laser or a phakic intraocular lens, and then the patient is from that particular region. We actually offer them, if you want, you can talk to these patients, get to know about their experience and make an informed decision. And this works very well for us with the inputs from the social media.
In fact, I started doing this thing that I stopped talking to my patients when they were giving reviews. So what happened is that I realized that when a patient sits across a doctor and the doctor is talking or the doctor is clicking a photo with the patient wants to say the best thing, because he knows that if he doesn't say the best thing, he's under pressure, he's under duress. So I asked my staff, you want to take patients' testimonials, please don't do it in the same room as me. So what happened is that patients started sharing their real experiences, because it never happens that like it was a magic and I just got in, I got out and everything was fine. No, you're going to have some amount of tearing, some amount of lacrimation, some watering, some little bit of pricking sensation that will go away with like medications in one day.
Absolutely.
But social media creates that impression that everything is so magical and wow, that the patients would get the procedure done and they say the doctor is paining so much, and I am sitting there like, I never told you that it's not going to prick at all. It's your expectation by seeing some utterly processed information that is being put out there on the social media that you got this expectation, and that is causing you the anxiety or the tension that you are having. So I think it's very important to actually talk to the patients, and like you said, talk to a patient or talk to a real person who has given a real review of what has happened or what has transpired.
I completely agree with you, Prakyat. It's extremely important that we do not trivialize what we are doing. Cataract surgery or refractive surgery, there's huge amount of equipment, huge amount of training, and multiple factors that goes into it. We are fortunate that with the present level of information, experience that we have, 99% of our cases do very well. But at the same time, it's human body that we are dealing with, and each patient might react a little differently, though ultimately the outcome is the same. So it's most important that you give the right kind of expectations to the patients during their counseling, and that's one thing we also focus on quite a lot.
Sir, so basically now I'm going to ask you to tell me the 3 top criteria that you would suggest a patient to go for lenticule surgery. Like, what would you see in the patient, the 3 things that would tell you that lenticule surgery is best for him, and similarly for a femto LASIK?
Up to about -8 diopters of sphere, cylindrical power of about 4 to 5 diopters, plus power of about +3 diopters, we go ahead and do the conventional laser-based refractive surgery. And in all these cases, lenticule-based surgery is our first choice, simply because the size of the incision that's made by this is just about 2 to 3 millimeters in size. Healing is very fast. The occurrence of dry eyes, higher order aberrations which deteriorate the quality of vision, and healing much faster are all the advantages that the lenticule-based surgery has over the femto-based flap surgery. So if I were given a choice, this would be my primary mode of treatment.
Sir, there is one kind of a difficult question to answer in a simpler way, but I see a lot of refractive surgeons who are doing a lot of refractive surgery, but they say that lenticule surgery is not good enough, or they've tried lenticule surgery and then moved away from it. In your experience, like you say, I also prefer flapless surgery over the flap-based surgeries any day. I keep telling my patients that this is better for you in the longer run. It will cause lesser dry eye, it's safer, and it lets me sleep better. It lets you sleep better. So why would that be the case that some people don't take up lenticule surgery? What are the hurdles in, shifting to lenticule surgery?
Actually, I think the only people who decree lenticule-based surgery are the people who don't have it. Frankly, I personally don't know of anybody, not just the Zima platform or any other platform, who have acquired a machine. Then there is a learning curve to it, and you need about the experience of at least 40 to 50 surgeries before you become comfortable. During that stage, some of the surgeons are complaining that flap-based procedure or just PRK was so much easier. But then once they get used to it, I think I hardly know of anyone who gave his machine back or stopped doing lenticle based surgery, because once you get comfortable with it, it's not just the surgeon but it's the patient's comfort which also matters, which much better. The day one post operative outcomes, the comfort level that lenticle based surgery gives is much better. And we have almost 15 different centers of ours where lenticle based surgery is done, and there are different surgeons doing it, and
Right.
all of them are stayed with it.
So one thing I want to ask you is that surgeon skill is very important in terms of thinking about doing a surgery. Learning curve and the surgeon skill are going hand in hand. So if a learning curve is very steep, then the surgeon skill would have more influence on the surgery. So LASIK, as we all know, is the easier version, or PRK would be an easier version of these cataract and refractive surgeries, wherein the least amount of learning curve is there. Learning curve is very easy. How would you rate lenticule surgery, phakic lens, cataract, and LASIK in their order of difficulty to ease in terms of learning?
I think, once you are a good anterior segment surgeon, you can pick up any of these quite easily. If you're doing, as all of us are, cataract surgery for years together, progressed over time with the different instrumentation equipment, you're familiar with the cornea, you're familiar with the anterior chamber, then it's not too difficult to master any of these, including the phakic intraocular lenses, where you do the entire surgery in a limited space. So yes, if you want to talk about whether PRK or femtosecond laser or the lenticle-based surgery are the easy, which one is easier? I would say PRK, where the laser does everything.
Is
Then
number one.
femtosecond flap-based surgery. Then third is the lenticle-based surgery, where essentially a certain amount of surgical maneuver is involved.
Yeah.
But as I've seen among my mid-level surgeons also, once they do 20 to 30 surgeries under supervision, under proper guidance, they get the confidence to do it on their own. And this is what we have been doing with our Zimmer machine across multiple centers. Nobody has said that I'm not able to do this, I'm not able to adapt to it, I give up.
I think that's a great addition, that value addition that the low energy laser with Z8 did. With the OCT and with this kind of a dissection that happens, which is very smooth, everybody is able to
Absolutely.
jump this learning curve and become a master very easily. It's much faster now. So thank you so much, sir. It was great speaking to you. Your insights are really very important to us, and I am so happy that you shared your knowledge with the audiences, your experiences. Thanks a lot.
Thank you so much for having me here. Good day.